It makes just a huge difference working with a qualified interpreter, from the patient standpoint, and I think from the provider standpoint too, just being really confident that the information that you need to give to a patient or a family member is, as complete as possible, and that understanding is going to be there. Sometimes had people just taking medications in the wrong way, where it just was not going to be effective at all because they didn't understand the administration instructions. So that's the difference between having a family member who might be fluent in the language, but if they don't understand the medical concepts too, where they're really trained to kind of have both the language proficiency as well as the medical knowledge, there can be a disconnect. And I think the services that we're able to offer locally, because that face-to-face interaction, I think, is really superior to, there's a lot of really good online services, but you lose so much nuance in communication when you don't have that face-to-face interaction that I think that, the gold standard to me would be having, an appropriately trained person in the room, with the provider and the patient. It's hard enough in medicine to realize, and to really be able to accurately assess how well somebody's understanding us. So we're really speaking a different language already when we use medical speak. And then when you have to make sure it's being, interpreted appropriately into another language, there's a lot of trust involved. And I think, making sure that you have somebody that's trained to the highest level possible, helps, develop that confidence, at least that you're getting information across as much as you can. The ideal circumstance to me would be, if you do have a staff member that's bilingual, is to have them go through the training so that they're certified as well. Because, then you have somebody, at least for the most common languages, which in this area, would be Spanish, you have somebody that's there that if you have a patient that's the same day, it's easy to arrange because, scheduling can be challenging. The more we can develop these resources as close at hand as possible is really important. But if you are really trying to make sure you have a patient or family that understands what's going on with them and how, what medicines might be needed or procedures or, other sorts of self-care, this is, time well spent, up front to get the best outcomes that, if they don't fully understand, that may lead to ER visits or hospitalizations or just more visits, with the office, and it's a liability as well. Doing it right the first time is important. The hugest example of the difference an interpreter made was we became aware of a patient that was hospitalized during the COVID pandemic that wasn't expected to live. And when I was reviewing the case, it became apparent that, they weren't using the appropriate interpretation, that unfortunate tendency sometimes to use staff rather than even one of the online services. And so being well connected at AllCare with our team, I was able to make sure that we got somebody in there, and this patient went from being not expected to live to being out of the ICU within like a matter of days. It was just this incredible turnaround. I don't know exactly what happened, but it seemed too big of a coincidence, that somehow understanding what was really going on and being able to make the appropriate decisions with information just made all the difference in the world for that patient and their family.